let's talk recovery. How long is recovery when you're talking about a concussion?
Well, most concussions and most symptoms will recover in about 7 to 10 days. That's kind of how long it takes the brain physiology to somewhat return to normal. You have about 10 to 20% of patients that will have a prolonged recovery, sometimes a month, sometimes 2 months, or even longer.
So whether you're an athlete or you have to go back to work, those 7 to 10 days, you recommend as a physician, you have to sit that out, you have to rest, correct?
Right. Well, you need to rest until you're able till you feel better, till you're without symptoms, and that's sort of the return to play protocol we'll discuss. But definitely it's hard to go back to work or go back to school or participate if you still have symptoms of a concussion.
But when you're an athlete, you want to get back in that game.
Right.
You want to play, you want to sit it out, and I think that kind of falls into the honesty thing you were talking about. But it's important for them to not do the sport, right, and not exercise.
Right. Absolutely. Well, because we know that getting back into play and even exerting yourself, even doing just mental tasks, can prolong your recovery. So just that alone can make things worse. Getting into a game and possibly risking another concussion,
right,
which could be fatal. I mean, there's cases of athletes, especially high school, college athletes, who return to play before recovering from the first concussion, and that's fatal. They can get something called second impact syndrome, where there's fatal brain swelling and death. So it's a serious problem.